Committee leading us in tonight's workshop, and I am excited to hear what they have to say. This is something that we talked about a lot when we were at the National Legislative Seminar in DC in March, and so it's kind of exciting to have them doing it. So thank you all for being here. And I will turn it over to Marge.
Okay, well, thank you, Pat, and thank you all for coming. This is wonderful to see all your faces. And I think I will just begin. I'm going to share my screen, and hopefully it will work. And excuse me. Okay, can everybody see this?
Mm-hmm. Yeah.
Yes. Okay. So we're going to be talking about effective letter writing and mental health issues. And you know, what we are an advocacy group. So I found this quote, which I thought really, it spoke to me, and it said, all advocacy is at its core is an exercise in empathy. And I know that everybody here is caring about something, you know, in their communities. And we really appreciate your being here. What we're going to talk about today is you're going to learn about the mental health in schools resolution that we're going to be proposing. You're going to learn about some mental health bills that are sponsored in the 2022 legislature, effective advocacy tips, actually from of our speakers, and we've been to the US Forum and gained a lot of information there. And then we talked about practicing writing advocacy letters. You'll see how that's going to pan out, okay? As Pat said, we are the Education Policy / Legislation Committee. We're nonpartisan, and all of our goals are for women, children, and education, which is part of DKG. So, you know, to be part of this, what we do is we support advocacy for women, children, educational issues. We also promote involvement in nonpartisan legislation. And we're going to show you how that's happening for some of the things we're doing. And we're going to provide communication to encourage member involvement. And we have been doing that. We probably, most of you have had contact, I hope, with your legislative chapter contact. And we've been meeting and, you know, going a lot of legislature things in advocacy, and hoping that people will share that with their chapters. And we'll go into that a little bit more. Kind of know us, but we wanted to know about who you are, because we were talking as a group and we said, oh, well, probably everybody knows everything we're going to be talking about, but we didn't want to make any assumptions. Now I'm going to ask you to use your chat, and we have 3 statements that we're going to show you. So we'll show the first one, and in the chat, you would rate yourself on that statement, 1 being clueless, up to 5, which was you would be an expert. So let me show you the first one, what I mean. Okay. The statement is, I'm aware of the mental health crisis in education in Washington and Washington state legislation addressing this issue. So you're aware of the mental health crisis in education and Washington state legislation addressing the issue. Are you clueless about this? Are you in between? Or are you really an expert on how this goes? So if you would just do, I didn't do a poll. So if you could just put in your chat, and we can kind of see what our audience is. And Keitha and Nancy, if you can kind of help us watch this, because this will kind of determine what we're going to be doing, you know, how much emphasis we give to things. But it looks, just briefly looking at it, I'd say that we're, you know, most of us are in kind of in the middle, you know, not totally, not clueless, but on the other hand, you probably want to learn more, and that's why we're glad you're here. The second statement, see if I can get it to do this. Okay, for B, I know who my elected officials are and how to contact them. Now, we've been doing a lot of this workshop this kind of thing in our meetings and some workshops. And let me check the chat for B. And hold on. And sorry. Thank you for taking the time to do this. Looks like we do have several people, and it's okay if you're, if you don't know, because that's why you're here. Okay. And Nancy and Keitha, do you see anything that we should pay attention to?
We're getting a little bit higher scores on this question.
Yeah,
Than we
okay.
did
More
before,
fours
yeah.
and fives than previous question.
Okay, good, thank you. And then the third statement is, I have written effectively to media and/or my elected officials about concerns of my community. And that could be a letter to the editor. It can be, something up on social media, or responding to a thing, or actually directly contacting. So if you would just take a minute to let us know. Excuse me. Okay, so it looks like we're kind of across the board on that one. So, we can have resources for you to help you with that. And these, we're going to cover all these topics. Okay, next. Okay, so, the title of this is, we were going to talk the mental health crisis and sort of legislation, what's happening with that. But why did we choose that? Well, hopefully, or some of you may remember that we asked our chapter liaisons to, we had discussions about what are we concerned about in our communities. And we came up with a list of 6 items, which you can see listed here. Then we asked the contacts to work with their chapters and to prioritize what was the most important. And it turned out that it was mental health in schools. And this was a topic that we said as a state we would address. As a state organization, we would address and advocacy things about mental health in schools. That's not to deny any of these other issues, because they're very important. And for different areas, that really is sort of a priority. But we wanted to say that this is what we were going to look at as the state. So the crisis in mental health, and I'm sure a lot of you already know this, but some of the facts that we found really almost shocking was that, one is that when we talk about mental health in schools, we're not just talking about the students, although it's very important for the students, but we're also talking about the staff, and that's the teachers, the bus drivers, the paraprofessionals, the nurses, the guidance counselors. It's that whole community that needs to be healthy for children to learn. Mm-hmm. School budgets are stressed. We all know that we need this. We need more help, but enrollments are down, inflation. It's very difficult, and we realize that. There is not enough adequate funding for assessing educational staff mental health concerns, enhanced employee assistance programs, mental health leave, and other support for healthy schools. So what we know, and the Surgeon General also had set out a thing about healthy schools and mental health, and it has been exacerbated by the pandemic. These issues did exist before the pandemic, but it is out of proportion right now. And if we ignore it, we're going to have more problems. And one of those might be less staffing shortages, an increase in that. Just to give you a few statistics, and you'll see why we give statistics, but we looked into, well, what are the facts about this? We all kind of know anecdotally, but we are finding much of this research came from the RAND Corporation, but that 73% of teachers report frequent job-related stress compared to 40% of other working adults. We also know that, or found that 27% of educators have symptoms consistent with clinical depression, compared to 10%.
Oh, man.
I'm sorry, is that? And I think we all agree, when you have a broken teacher or a broken system, the children are not going to be able to learn. Plus, we care the empathy about what teachers are going through. Also, the statistics show that disrespect by elected officials, parents and community, students and the media, bullying and other threats contribute to stress and anxiety levels as reported by over 30,000 educators. And I think we've even had some of our teachers in different conversations that our groups have had about what our teachers are going through. We also said that, and this is alarming, that teachers are reporting that they are likely to leave their jobs, and that has risen from pre-pandemic levels of 16% to over 25%. Also, 57% of these teachers are seriously worried about burnout, and that's very understandable.
Marge, I'm sorry, would you go back and let me see that very first statistic?
To 73%?
Yes, and I'm wondering if you could tell me when this data was collected.
I think it was in 2019 or 2020. Okay. But I can get back to you on that, specifics about that and where the resource is. Okay.
Thank you.
Okay. Any other questions or comments about that? Okay. Let me move on then. So this is all leading up to what is DKG in Washington State? What are we going to do about this? And we have been working on a resolution. And I say we, there was a group of us that Pat went and Susan Fritz, who is our U.S. Forum representatives, excuse me, and Nancy and myself, we went to the U.S. Forum in Washington, and we were working on developing this resolution. We also went to visit some of our elected officials, actually asking for a national legislation to help specifically school staff. But the resolution that we're working on for the state and also for DKG is asking, this is our ask, we want to become on our chapters to become knowledgeable of issues, needs of students and staff of mental health, and I'm sorry, I have a mistake there, and appropriate programs. So it's knowledgeable. We want to initiate, endorse, and support the writing, passage, and implementation of legislation for enhanced mental health support services for students and school staff. And that's where some of us, when you come in, you may personally decide this is what I want to do. And DKG, Washington State, is willing to help you and help you write to your representatives and contact them. We want to promote dissemination of information about mental health issues and needs. Oops, I'm sorry. Engage in activities that support for educators and monitor our progress. So and monitoring progress means that, we would like the chapters in our committee to say, okay, what are we doing? How much information are we able to give to our people? And hopefully, even DKG or the National US Forum could help take over these goals. Do I have any questions or comments about that? No? I'm sorry, Lynn, I see your mouth.
Sorry. I'm sure at some point you will go over the timeline, correct? Of what will happen, when is this going to be presented and that sort of thing.
Okay, yes, the Pat's nodding her head too. We're in the process of several things, but thank you, Lynn. Yes, we will be. Okay, so the next is Keitha is going to talk about some of the mental health legislation that's going on within our state legislature. Keitha?
Unmute yourself, Keitha.
I'm so used to being a quiet mouse. So during the 2021 session, House Bill 1363 was actually passed, and it's a 2021-2022 bill because the biennium to fund it is 2022. So the title of the bill is Addressing Secondary Trauma in the K-12 Workforce. This one was written specifically for educators because they were so stressed out over the combinations of hybrid, not hybrid, in-person, virtual only, and administrators. And it started out a little roughly since no one anticipated all of the new technology skills that people would need to have. So the bill sponsors for that one were Lillian Ortiz-Self, Lisa Callan, Representative Davis, Ramos, Simmons, Berg, Morgan, Berquist, Harris, Talley, and Paulette. And the reason Ortiz-Self is highlighted is she was the prime sponsor for this bill. She's a school counselor in the district she lives in. House Bill 1834 was sponsored this year by Lisa Callan, and Lisa wrote it concerning student excused absences for mental health reasons. There was a lot of call for that from kids who were on overload, especially the secondary students, and they have authorized excused absences for those mental health reasons. Next slide. House Bill 1477 is one that was sponsored by Representative Tina Orwell. She's a social worker, and her goal in life is to make sure that there is a lot more help for suicide prevention and mental illness. So 1477 implements the national 988 system to enhance and expand behavioral health crisis response and suicide prevention services. And recently, one of the parents that I work with here in Thurston County, she's a Nisqually Tribal Healthcare Authority person, came up to me and told me that she had been asked by Tina Orwell and Senator Karen Kaiser and a couple of other representatives to go to Arizona last week to check on how they rolled out that 988 system. It is national, and they wanted to know whether it was working correctly, so that they had people who knew and were trained in health, mental health care, to be able to respond to emergency calls rather than 911 numbers. Next slide. There you go. We're back to you. So
I have a question. I have a question.
Yes,
Kathy?
Keitha, one of those, I think it was on the first slide, it talked about recognizing secondary trauma Yeah,
Mhm.
addressing secondary trauma. Can you describe that, secondary trauma?
The secondary trauma is the overload for the work. And earlier, Marge mentioned the funding had dropped for classrooms. There was a bill, which I didn't look up, but there was a bill to restore some of those funds to district because of lower student enrollment due to virtual. The secondary trauma is literally part of the pandemic. Extra workload, not enough funding, resources weren't given to teachers, and that was what it was about. But if you go back, Kathy, and read 1363, it's really a pretty interesting bill because it does outline the things that they wanted to help with. The other thing is that Ella DeVerse from the Office of Superintendent of Public Instruction sent me an email with the links to how that bill would be rolled out. And I will email that to Marge and she can mail that out to participants because it was really good information about how the districts were going to get help.
Okay. Thank you.
I see that, Lynn, you have your hand up. You got a question?
You're muted.
Just for clarification, Keitha, all three of these bills were passed.
Yes, they are. They are bills, and if you look them up, they are session law now.
Thank you.
Mhm.
Okay, and Pat, you had your hand up?
Yeah, just two things, just to add on to that definition of secondary trauma. If you will think about working with kids who are suicidal, who are drug addicted, whose parents are having problems, poverty, all those kinds of things, and the stress and pressure that puts on you because you want to fix it, because that's what teachers do, right? All of that is also considered secondary trauma. So when you've been engaged with a person who has had primary trauma, but you're working with that person, that's secondary trauma. The other thing that I wanted to mention, there's one more bill that didn't get talked about here, and I can't remember the number. Keitha, help me out. They did pass in the state legislature this year that there is increased funding to school districts under the funding formula for support staff that would work on mental health kinds of issues. So except for this first bill, 1363, all of the others refer to students. So one of the things that I would just like to raise, just saying, student absences for mental health reasons are now excused. How about teachers? Just saying.
Pat, I do know a few teachers who have been able to pull that off with a doctor's note. It's because they need some time to regroup and restore their health.
But if you needed to take a short term, a day or two,
Without having to use your sick leave or something.
Well, the Family Leave Act gives you more sick leave than you might have left in your bank in the school account. So, and that was during the Clinton administration that the Family Leave Act was created.
I thought I saw a couple of other hands up.
I have my hand up. This is Jessica from Beta.
Okay.
So my question is, the one House bill you said that does address teachers, but you said it was specific for COVID. So is that funding going to go away? Because as someone who's working in the field and was working pre-COVID, COVID, and post-COVID, the problems were always there. They're just exacerbated by COVID. So
I do not think that it is COVID related. It is.
It's not a COVID funded thing. It's actually going to last. Okay.
Right.
Mm-hmm. Yes, it is.
Good.
And that Lillian Ortiz self did that one. That was the secondary workforce trauma. And she recognized that because she is a school counselor. So I don't think that bill's going to expire anytime soon. She knew that both educators and students needed the help.
Okay, any other questions? All right. So well, thank you, Keitha. Lots of good information. And is this Nancy?
Right, this is my slide here.
Okay.
So we're going to move into how to advocate, why to advocate, where to do it, how to do it, how do we make the most impact. Personally, I learned a lot in Washington, D.C. from our speakers. So I'd like to share some of the things we learned there. Next slide. These next few slides are borrowed from Susan Fritz, and I think from one of our speakers. The advocacy axiom says, even if we can't make them do better, we have to make sure they know better. That was from Lucy Getman and one of our consultants we heard from. The next few slides are showing some percentages of what is effective. So 78%, multiple constituents. That's a little too fast. I couldn't read it.
Yeah, I forgot she put timing on this. Go ahead.
Affiliated with a group. So, for example, several constituents who are members of our group, Delta Kappa Gamma. And then 75% effectively a leader or representative of a group, chair or representative of Delta Kappa Gamma. Next slide. 71% effective, multiple constituents not affiliated with a group, but several constituents not from a group. 69% effectiveness, constituent affiliated with a group. For example, one member is a member of Delta Kappa Gamma. Moving on, 59% effective, constituent not affiliated with a group or part of a group. As you can see, the group membership has more weight. Big drop here, 30% individualized email messages from constituents. Yeah, they make a point, but they're not quite as viewed as quite as important. 25%, more than one person who doesn't have constituent status, such as they're not living in the person's state or congressional district. That is considered less important. And 8%, I got to question this one, a visit from a lobbyist, because the lobbyist that we heard in Washington, D.C. Is now working for a Catholic charity, but previously was a lobbyist for corporate. And she mentioned that she always made sure after she got an appointment that she had a check to bring along. And I raised my hand and said, well, I'm curious, how much was the check? And she said, oh, whatever the limits were, if the limit was 1,000 or 2,000, we made sure we gave them the full amount. So there you go. That might bump that one up higher on the list. Okay. And 3%, an email written as a form letter or message. For example, you see a Facebook post and you click, yes, I agree. Not too effective. So how do you write an effective letter? Let's look at some techniques to strengthen your impact. Take a look at this handy guide. This is on the DKG Washington website. We followed this when we made our little trip to our legislators. We started by introducing ourselves and mentioning our credentials. Not so fast, Marge.
I know it's automatic. I'm sorry.
Yeah, take it back.
I'll keep going back. So credentials.
The critical point, what is my issue? We focused on one issue. We chose mental health for teachers and educational staff. Third thing was personal impact. Relate your story. Do you have a story that is an example of this? That is considered pretty powerful. And we heard some powerful stories while we were in DC. Next, citing some evidence. And finally, the ask, what do you want done about it? That should be your concluding sentence, Okay, we'll let it go forward now.
Okay, I'm sorry.
Well, thanks for reversing.
Technical
the-
difficulties.
So what works for elected officials? Things that they value: individually composed letters sent by email, phone calls. You can leave, gotta go back, Marge. You can leave a
I
short
am.
statement, but your name, address, and voting district is usually not asked or recorded. So I think that's less effective, really. Might not take much time, but it's kind of more anonymous. Third, US mail, but they prefer electronic documents. If they get something in the mail, they will scan it, but then they're going to throw it away. So email's a lot faster and more direct. Sorry, what was number 4? Going back. Marge, going back one.
Letters to the editor.
Yes. Okay, about letters to the editor. Yeah, this was good news to me. They do read letters to the editor. They do have their staff keep track of how many letters are received. They do keep track of how many people write on a certain topic. Their kind of limit of importance is that if they get at least 10 letters to the editor submitted, then that's they consider that an important topic that they ought to be paying attention to.
And Nancy, before you get into that detail, Marge, in order for you not to go crazy, if you go into your slideshow under transitions and turn off the timing, you'll be able to do it by hand.
Yeah, that'd be a lot more helpful. You're muted, Marge. Marge, you are muted. You're still muted. There we go.
Okay, yes, I have to go back into the PowerPoint and unshare, and I will take those transitions off. And okay.
Well, my last statement on that last slide about 10 letters.
Have it do manual, Marge, have it do manual, apply to all. Or, advance with the click and just apply it to all.
Okay. Yeah. That's what I thought it had it on, but all right.
I'm sorry, I just think it'll make it life easier for
Yeah,
everybody.
it would make it easier to be able to watch it too. So thank you.
Yeah, the last point on that slide was kind of an important one, because I want you to think about what power you have. You have a chapter that you belong to. And if you have an issue that your group is passionate about, if you can get 10 letters to the editor or 10 letters to a particular representative, they will pay attention to that. And that's not hard for us because we have a group of engaged, passionate teachers here that don't mind writing a letter and can write a pretty good one in most cases. So keep that in mind if there's an issue that you might want to bring up to your group. Hey, we need mental health for teachers. Let's write some letters. Okay.
okay.
We're ready, Marge. Hopefully,
All right.
we'll be able
Hopefully
to
this will
go a
work.
little slower because I don't think I can talk any faster. I tried to put a lot on each slide so we wouldn't have too many of them.
Okay, hang on. And let me get back into. Thank you for your patience, folks. It's always
Yeah.
something, right?
Challenges of Zoom.
And operators too, including myself. Okay, so can you see this? And
There
we'll
we go.
into the slideshow.
Last sentence. This is how our groups can be a powerful voice for change. Okay, go ahead to the next slide.
Go to the next one.
So what works for letters to editors? I'm going to interject that I joined letter to editor writing
Still doing
group.
it.
I joined a letter to editor writing group a few years ago. We meet about once a month. We discuss issues, and then if we're inspired, we write letters to the editors. So here's some tips that my group follows.
Okay. Okay, I'm sorry, Nancy.
Okay, I'll just go over them.
Okay.
Number one, find out what publications are in your area. I live in Bellingham. We generally submit to 5 newspapers, 3 are print, 2 are online. And if the issue is regional, statewide, or national, we submit to a larger publication like the Seattle Times in our area. Number 2, find out the requirements, because each publication is kind of different on this. Some require no more than 250 words, others up to 400 words. One publisher offered us an op-ed article if we want to write something longer. In general, though, I feel like the shorter you can make your letter, the better. More impact and fewer words. A lot of people don't read all the way to the end of letters or articles. Number 3, find out the number of submissions for your papers, because some limit individual writers to 1 letter per month. In my area, for sure, that's a pretty common rule. Number 4, find out if endorsements of candidates or causes are allowed, because some publishers do not allow this, others do. Number 5, it's always a good idea to send your letter once you composed it to your representatives, because you've already written it. Why not send it to a broader audience? There's no guarantee that your letter to the editor will be published, but your representative will at least give you a tally mark for the cause you're advocating. Save these addresses in your address book so that you can do that with a few short clicks. Yeah, let's see. I think I went over those, Marge.
Okay.
The next slide, I think, is about resources. Our own state website under resources. Look at the Advocacy Toolkit. In addition to that graphic about the hand, you'll find like 4 or 5 page paper about writing an effective letter. Another source is the international website. You go there, look under the U.S. Forum. Another great site is the League of Women Voters. There's a Washington State organization, and then there are county chapters. Both have great resources. The one from Bellingham is really quite extensive. It's almost, sometimes I think it was like it's almost too much, but it's great. They have tons of committees and they're very active. Lots of information on current legislation and you name it. And then the last one I thought of was the Washington State School Retirees Association. They have initials WSSRA, and every county has a chapter as well. And those are, they usually focus on school retiree issues, but a good source of information. Because I think some legislation that Keitha didn't mention this year did affect retirees and what plan you're on and that sort of thing. Okay. Were we going to go to, I think we were going to go to questions next, and then maybe breakout room discussions. So does anybody have questions about what we've talked about up to this point in time that you want to discuss as a large group?
Pat?
Not really a question, but Nancy, could you give us an example of how your writing group works? I mean, what's the process it goes through?
Yeah. So this particular group that I joined is through my county Democratic organization, because I decided to join the Whatcom Democrats after the 2016 election. I just felt like I didn't want to just complain on Facebook about the election. I wanted to actually do something. So I went down and met my party officers, and soon after that, I was signing up for this letter to editors group. So our structure is very casual. We meet once a month. Before the pandemic, we'd meet in people's homes, and after the pandemic, of course, we moved to Zoom, and continue on. I think we plan to use Zoom more because we live kind of far out where it encompasses the whole county. And in this case, Bellingham's divided in half, so it's 2 legislative districts and 2 congressional districts that we all represent. But we meet once a month, and it's just pretty free flowing. If people are impassioned about a particular subject, they'll say, "Hey, I'm really upset about these." For example, DCEs for Medicare. And I don't know if you guys know about them, but Medicare is sort of surreptitiously being converted to private ownership of Medicare. It's something Trump started, and it hasn't been reversed. So we, most of my group actually are retiree age, and so we are affected by changes in Medicare, and that's an issue that we'll discuss. But it's like all options are open. If I want to bring up the mental health in schools for teachers, I'm free to do so. We discuss it, and it's just perfectly up to individuals. If they feel motivated to write a letter, they do. And the other thing that my group does is, besides the structure, besides meeting monthly, about once a year, we go over those 5 publishers in our area and make sure we know their rules. Because sometimes rules change, like I said, some require 250 words, others gives you more, and some say, well, you can only write a letter once a month. And so we want to know their rules and their addresses where to send our letters. And that's about it. It's a pretty low-key group. I think any group could form a letter to editor writing group quite easily. And yeah,
It's gonna make a great program.
Make your voice
It'd make a great DKG
stronger.
program.
Exactly. This like as an individual, like you saw in those statistics, an individual can write a letter and has a certain amount of impact, but a group even more. And I know that, like, through my work with the Whatcom Democrats, I have found, like, reaching my legislators, it makes a difference to them if I sign just my name, or I sign Nancy Sheng, Outreach Committee of the Whatcom Democrats, or Candidates Committee, or whatever it is that I'm doing. Well, I get more answers back when I do it. I specifically remember one time I sent a letter to all my state and county and city representatives because I was all upset about an issue. And I didn't get much response at all. And so I was kind of mad about that. So I sent a second letter, but I signed it, Nancy Sheng, Whatcom Democrats, Outreach Committee, Candidates Committee. Well, lo and behold, all but one of those representatives answered me in a short amount of time. So I think your credentials help. You may not be in the political organization, but you are in DKG, and all you have to write down is Delta Kappa Gamma, women educators in Washington State, and doesn't hurt to mention we have 600 or 700 members statewide. Doesn't hurt at all. This is how they will pay more attention. And that's what we want. We want them to pay attention to our issues, right?
Michelle Kerwin had her hand up.
Yes.
Go ahead.
I was wondering, could a group letter be sent and then many signatures underneath it, like from a chapter?
I wouldn't do it that way.
No, that doesn't.
It would be
I'm
just
sorry. Go ahead, Nancy.
easy. It would be just as easy for you guys to compose the letter. Well, although they don't like form letters, really, compose a core letter, but start it individually, end it individually. Maybe you use a little bit of the text in the middle and put individual names on. And then it's the way they look at it. They want to know how many people are interested, and they don't like form letters. They don't like clicks on websites. They like individually composed letters, and they apparently like letters to editors that get published. Those are the 2 strongest ways to get through. Now, I'm saying this from the instructions we got when we went to Washington, D.C., and the people we listened to were like consultants. Like I said, the lady that was a lobbyist. Those are the experts that we listened to, and that was what they were telling us. One of the experts, I thought he was really helpful, and he had been working in Washington, D.C. for more than 20 years. He worked for a nonprofit organization that just, it just basically helps people get appointments with their legislators. Wasn't a lobbyist per se, but he helps individuals get through to their legislators. That's the whole purpose of his foundation.
I think they told us that one letter might get read, might not. 2 or 3 letters, probably going to get read, but when they get like 10 in 1 week's time, it definitely makes an impact. Definitely makes an impact.
Yeah, for sure. Susan, you got a question?
I do. Hi, Nancy.
Hi.
I think it would be very helpful for many of us to be able to see an example of a letter that you had written. Specifically, the Medicare issue, I think, is something that many of us are concerned about. So even if we had a model to take a look at, and then we could springboard from that and make it our own. But if we had a concerted effort for folks to send it in within the next, like within a period of a week, I think that would make an impact.
Yeah, for sure. And I mentioned DCEs, right? DCE, for those of you that are Medicare, is a direct contact entity. It's complicated because all healthcare stuff usually is, right? But DCE is something that, for example, here in Bellingham, our main hospital, Peace Hospital, has signed up for. And suddenly, if you have Medicare, you don't go directly through Peace Hospital anymore. You go through an intermediary. The intermediary is kind of like an insurance company, or maybe a Wall Street entity. They're basically making a profit on the patients that are getting payments, getting healthcare paid for through Medicare, but the payments somehow go to this DCE. And furthermore, just to complicate it a little bit more, they've changed the name now. So it's no longer called a DCE, but it is a program that started in the Trump administration. And so far, the Biden administration has not changed it. The only thing I think that I know of that has changed is the name. And so now it's a new name for, it's just, I don't know. I think it's just a scam on Medicare, but it's not all that widespread yet. And I even heard a doctor give a presentation on it from Peace Health, explaining why he thought it was a good thing, but he didn't talk about the financial aspect at all. He felt like the DCE could help them offer better patient care in this way or that way, but he never mentioned the financial incentive that these DCEs have to take over Medicare payments. So I wasn't too convinced because he didn't address that whatsoever. Yeah, but something to research, that's for sure. And I don't mind sending you guys sort of a letter. I don't know if I've written one, to tell you the truth. I will certainly ask my friends, because one of the women in my particular group is pretty much an expert on that subject. And she brings it up almost every month. And so we've had letters. I'd be glad to send that. I just want to know who to send it to. Should I send it to you, Susan, or someone else?
Well, actually, we could send it out in the next legislative issue. Marge, could we go ahead and do
I'll send it
that?
to Marge. I'll send it to
And
Marge.
because
Yeah.
because this is being recorded, and chapters may want to use a portion of it, we could
I'll send
extend
it to you,
it.
Marge. I'll send
Okay.
it to you,
There we
Marge,
go.
and you can put it in your next.
And we'll send it out
Thanks,
to
Nancy.
the legislative contacts.
A lot of people I talked to never heard of it. They go like, DCE, I never heard of that. What is that? But it's going to affect you guys for sure.
Thank you, Nancy. Keitha, you have your hand up?
I do. So I belong to the Thurston County League of Women Voters also, and they meet once a week. It's called Coffee with the League. And Paula, who organizes that, goes through like the news and picks 4 or 5 issues. And she brings prepaid postcards and pens and a script for writing. And everybody sits down and has coffee. So if you have the capacity to do that in a small way in your community, it works really well. We've heard back from a lot of elected officials in Washington, D.C. about some of the topics Nancy was mentioning.
Good.
Other topics are, the League of Women Voters includes things like Save the Salmon and those medical forms and those kinds of things, but those are a great way to get people together to write. So the other thing I was going to mention is that the Washington State School Retirees Association does have a unit, is what they call them, in every area of the state. Everything I learned about how to do effective conversations with legislators was from the WSSRA. Find that unit in your area.
I think they're organized by county,
Mm-hmm.
pretty sure.
They
where
are. You can go to the
Washington-
WSSRA website and look up where the
Yes.
locations are.
Exactly. Good.
Okay.
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 So
What
I
time
guess
is it?
we wondered, it's 5 to 8. We were wondering if you guys want to go into breakout rooms and use that hand graphic to talk about an issue that you're passionate about, just for practice, that could become a letter. So maybe you can a show of hands if you'd like to do that now, because we were also
Jennifer
thinking,
says no.
we were also thinking nobody usually objects to ending early. So if you guys are interested in breakout rooms, I would say now's the time to raise your hand, and if not, we could just end the discussion if we're done for tonight and say have a nice night. Keitha?
I have a comment. Lynn has invited me to do a presentation to her chapter. And so if you're not wanting to do the work tonight, invite me to your chapter and we'll do a workshop in person and make things go. And I'll bring all of those same skills with me and teach you how to do that.
Okay. Thanks,
So,
Keitha.
yeah,
Okay.
I just don't want to let that go, Nancy, because it's important that they know how to write those letters, but it's also important. So one more thing I want to bring up, and that is your chapter timeline. So in August and September, when you meet as chapters, you need to identify what your community needs are. What does your specific community need that you don't have that the legislature might be able to provide for you? In September, you practice writing those letters to your elected officials and make the ask. And in October and November is when the elected officials are in their committee meetings. They're getting ready for the legislature, even though it's not starting until January. When they're in those committee meetings, you can find out whether your elected official is on the education committee, the health committee, businesses, any of those kinds of things, just by looking them up. So in case you don't remember how to look up your elected official, it's leg.wa.gov.
Yeah.
And when you go to that website, it is the it's the whole legislative site for the state of Washington. On the side, you'll find a little menu and it says, find my district and legislators. You click on that button and they ask you to enter your address. Once you do that, the elected officials that represent you will show up and you can find out how to contact them by doing a little bit more surfing. If you have friends in another state who you talk to or family members, our leg.wa.gov site doesn't work, but the National League of Women Voters has a site that works everywhere in the United States, and it's a similar site, and it's vote411.org. When you do that vote411.org and you live in Pennsylvania, you get the same results. They'll ask you for your address and you'll find out who your elected officials are. So kind of spread that around and make sure people understand how to contact their elected officials and talk to them. Thanks.
Thank you, Keitha. Pat, you had your hand up?
Yeah, you had asked about the timelines for the resolution. I didn't know if this was the time to do it or if these other questions need to come first, and then I'll do it before we leave. However you want to work with that.
Does anybody have another question at this point or a comment?
You got two more people with hands up.
Okay.
I have a question for Keitha. Do the legislators change committees every year, or do they generally stick with the same one?
They'll typically go to the same ones, but every once in a while, a newly elected official will get a different committee than they might have expected. So it does tell which committees they're on. When you click on their bio in that address, you can go to their website and it tells you which committees they're on.
Okay, and then this question might be answered by Pat. I'm wondering if the resolution, if we vote for it, could be developed, or could we ask for a bill that could be taken to committee to be discussed this January, or excuse me, in January of 2023?
I'll address that.
Okay.
Question. Thank you. Yeah. Do you want to
Nancy?
address that?
Yeah, go ahead.
Nancy?
Good. Go ahead, Pat.
Well, I didn't know if yours was in response to these other things or.
Well, the only thing I forgot to mention, I think, was that on our own state website, the hand graphic that I showed you is part of another document, but however you get to it, I kind of forget, but it's called an Advocacy Toolkit, which is a lot of helpful hints there. So if you're ready to write some letters or do some kind of other kind of action, I would encourage you to look up the Advocacy Toolkit because it's a good document that is on our website that will help you.
You can find that under resources on our website, advocacy, might be ed policy and legislation, or you can just on the homepage, there's a search line. And you can just type that into the search line, it'll take you there.
There you go.
Which is kind of new, so I'd like folks to try it.
Yes,
Try it
that's
out.
very nice.
Oh, we needed one. I'm glad you guys got that finally on there. Yeah.
So resolution and legislation, where and how are we dealing with that? So let me talk about the resolution first, because the resolution is asking our executive board, or this is what's coming up at tomorrow's meeting anyway, is asking you to authorize our group to go to the US Forum and present a resolution. And that would be in July. Because they meet on July 16th at the International Convention. We have been working with, so this is Nancy and Marge and I met with the steering committee for the US Forum just Wednesday. And they have reviewed, they had a few questions and a few concerns about some of the language that we used. And this will, I don't know, some of us found this a little irritating. You know, purpose number 4 says that our fourth purpose is to initiate, endorse, and support legislation. But apparently international, because it's an international organization, has received an opinion, a legal opinion, that they can't do that. Individual members can do that, but as an organization, they may not. So we have to change the language in the resolution a little bit to say, we will inform members of information so that they may initiate, endorse, support legislation for mental health issues.
Has to do with our nonprofit status.
Yeah, it has to do with our being a nonprofit. So purpose number 4 is there's a little tension there right now. But at any rate, the idea is that on Friday, we're asking the executive board to say, yay or nay, we don't want you, or we do want you to present this to the US Forum. And then in July, we would go and present it. And I think some of the slides that Marge used tonight will be excellent for a real quick little presentation as to why we think that DKG US Forum, which means the US states and chapters, ought to do some things around mental health for teachers, because the legislation doesn't really cover teachers. And so we need teachers to, I mean, we need our organization to get behind that. And we're asking them to do it in several ways. One, become informed ourselves as to what the issues are. Like when Marge put up there that's, 40% compared to 23%, I heard a gasp out of somebody. Yeah, people need to know that information, that mental health issues for teachers is a big deal. And that it is leading to people leaving the field. And we need to also destigmatize getting help for mental health issues. It needs to be okay to take a mental health day, and people shouldn't have to lie about it, it should be allowable. There need to be more resources available to teachers, whether through employee assistance programs or some other source. And we need to take care of our members who are actively working teachers who are exhausted. So that's what the resolution is asking chapters and organizations to do around the country. And so if the executive committee says, yes, we'd like you to present that, then we will go and work with the steering committee. We would love to have their endorsement on it, because that will make it much, much easier for the whole US Forum to endorse that. And then each chapter, each state has to interpret that their own way. Here in Washington, we know that it means we're going to help to work on legislation. So the second part of that question, are we doing anything relative to legislation? We're doing two things right now. And we need to, as soon as this convention's over, get ourselves rejuvenated on this. But when we were in DC, we met with, as Nancy said, we met with Larson, Kilmer, Jayapal, and Murray's staff. Okay. Senator Murray's staff and Representative Jayapal both are on education committees. Senator Murray leads that. I'm not sure whether Representative Jayapal leads it or is just a member of it, but she's on the House side with the education, and they're both very interested in doing some legislation. Derek Kilmer is on the Appropriations Committee, another key committee, and he's very interested in it. And what we looked at was a bill that passed the legislature, passed Congress, folks, not too many of those these days, that was called somebody help me with it. I never remember that gal's name. She's
Dr. Lorna Breen.
Thank you. The Dr. Lorna Breen First Responders Protection Act. And what it does is to try to destigmatize mental health resources for first responders, provide knowledge and information to first responders about resources, and provides funding for some additional programs to help first responders. Well, we looked at the legislation and said, if you took out the words first responders and put in the words educational staff, terrific bill. So we're working at the national level to try and see something come through there. At the state level, my state senator is, just drew a blank on her name, Christine Rolfes, who is head of the Appropriations Committee for Washington State. And I have already chatted with her, and she and I are meeting this summer to talk about doing something similar for the Washington State Legislature, because one bill that recognizes secondary trauma, which is really important, but what it does is mostly it's study committee kind of approach. Well, we need to expand employee assistance programs. And one of the pieces of data we learned is that only 6% of teachers use employee assistance programs. That's not very good stats. So people need more resources, and schools need funding to provide the resources there, not just to provide resources to students. So those two things are at least going already. I see two hands, Keitha and then Susan.
Yeah, go ahead. You answered it.
Oh,
Go, Susan.
Oh, okay. Just a little background on Dr. Lorna Breen. She was a physician, and it was in 2019, and she committed suicide. And so this legislation was brought up presented last year, and it was just signed a week before we got there by President Biden. So like Pat said, it kind of mirrors exactly what we wanted to do for mental health for educational staff. So it was kind of a wonderful segue to take some legislation that pertains to mental health and fit it into what our cause was. Anyway, that's a little background.
thank you, Susan.
Welcome.
So, any other questions, comments? Well, thank you, because you've given us lots of feedback, whether you knew it or not. As on the committee, what we need to keep providing for all of you. So please feel free to, send emails, phone calls, and ask us, because we really want to get out there and help all of you and our chapters. And plus, you probably have some good information or advice for us too. Darlene, you have a question. You have your hand up.
Oh, I just wanted to make the statement that there are several Oregon legislators that would come on board to join Washington legislators in that effort too. So if we could make a Northwest pact of some sort.
Great,
Oh,
great.
For those of
Yeah,
you who
that's
don't
a
know
good idea.
Darlene, she was the past president of Oregon, of the state of Oregon. So thank you, Darlene. Thank you for being here too.
yeah.
Well, thank you for the invitation to join you.
I'm glad to have you. So,
My hand's back up.
yes, I don't know if it ever went down, Keitha.
No, it did. What I wanted to comment about is I don't remember which region she's from, probably the Northwest one, but Yvonne Gatley from Wyoming joined us in some of the earlier meetings that we did. And she was just stunned by learning some of the stuff you learned tonight. But she'll be in charge of teaching that kind of stuff at the national level. So I wanted to give you her name, Yvonne Gatley from Wyoming. She had no idea how her state website worked. And so we taught her how to use the Washington one and then gave her the vote411.org. And she went through it and she said, you're right. There is access to this. This is what everybody needs to know. So you guys have launched an episode.
This is true. It's exciting. It really is. So. Well, it's getting to be 10 after 8. I think we could go on all night, but is there anything else we can give to you? Oh, sorry, Jan, you have your hand up. Jan Blanchard? Do you have your, no? Okay. All right, sorry about that. So go ahead, Pat.
I was just gonna say, Jan, there.
Yeah,
She's on.
I don't have my hand up, but my head has been going overdrive here.
Yeah.
I was wondering, again, to expand internationally with all the children involved with the war over in Ukraine and with countries, again, all over the world absorbing these kids that have trauma from the war situation. Could that not also be under this mental health umbrella? Because there's not only Ukraine, you know, there have been the conflicts in Syria and Afghanistan. I mean, everywhere. And these kids are moving internationally and they're being absorbed into schools everywhere. So we've got that mental health issue also that needs to come under this umbrella.
It's a great thought. Most of our international states, our countries, most of them, not all of them, but most of them are prohibited from doing any kind of advocacy legislative work. However, we are a member of the, DKG is a recognized non-governmental organization with the United Nations. And that's a perfect avenue for us to go through, is to talk to our international reps who are the NGO folks, and ask them to bring that forward through the UN. And if you were around last year, last spring and last fall, we had Connie Renzick as our international guest. Hey, Connie is one of the NGO reps. So that's excellent, Jan. Thank you.
Yeah, good. Thank you.
I want to say thank you to Marge and Keitha and Nancy. And I know Susan, bless her heart, is in the middle of the night in Paris.
It's okay, I'm awake.
Oh,
It can be done all over the world, so I just had my computer plugged into the wrong socket. And as much as I was using my computer and getting on Zoom with my son, and there was no power coming in. And so right before I tried to get on, it said, you have no more power left. It's like, oh my gosh.
She's in Paris, just so you know, and it's almost morning there now. So have a good day, Susan. We'll see you
It's about
somewhere
5
in the
a.m.
middle
right
of tomorrow
now.
night. And go from there. But thank you, ladies. I think this was really valuable. I think there's we definitely want to put those slides up for all of our chapters to see, and make sure that all the chapters know of your willingness to get out there and provide a program for them, whether it's on Know Your Legislators or how to write letters to the editor or to your legislators. I mean, those are excellent program ideas, and I appreciate your work with us tonight on this. Thank you.
Thank you,
all.
everybody.
Thank you.
Okay. All right. Have a good night.
Good night.
We'll see you tomorrow.
Yes.
Yes.